Hey guys, let's talk about saline versus silicone implants today. And if my skin looks a little orangey, it's because I just had a facial with Alexis, our esthetician, and the last product is like a little orange tinted, but it's an amazing Glow 2 facial. It's got lymphatic massage, radio frequency energy to build collagen, it exfoliates. It's very nice, so come try it. We just got the machine and I was trying it out today. Back to saline versus silicone. So the most important thing to know about the two implants, they are both in a silicone shell. They have the same risks in terms of rupture, capsular contracture, breast implant associated anaplastic large cell lymphoma, breast implant illness. There's no differences between the two implants. The two main differences are one, what happens when it ruptures, and two, what the implant feels like and looks like. So saline feels a little bit more like a water balloon, more likely to have rippling on the edges. Silicone feels more natural. On most patients, I will recommend silicone unless you prefer saline, or if you've had saline implants and you're comfortable with them and you like how they look and feel, then it makes sense to stay with the same thing. In terms of rupture, silicone is a cohesive gel. So when the shell ruptures, that silicone's not going to work its way out for years and years. So you won't know if it ruptured. Saline, the saline is going to leak out of the implant and your body's going to absorb it. You get a little hydration. But because of that, the breast is going to shrink up on that side. So you'll know it's ruptured and you'll be lopsided. With saline implants, because you'll know if it's ruptured, you don't really have to follow up unless you're having issues. With silicone, because you can't tell, we like to see it back every few years for an ultrasound to look at the implant and make sure it's intact. But that's really the only difference. So it truly is your preference, which one you want. And in terms of safety, know that it's the same for both.